much.
Thank you very much. Can I quickly just follow up? So as far as I understand, Turkey didn't share the results regarding phase 3, right? Because Turkey has started applying the vaccine to its citizens. That's why I'm asking. Thank you.
Thank you so much, Bersa. So what we have learned, at least for the time being, is that the phase 1 and the phase 2 trials have been completed, and the National Regulatory Authority in Turkey has evaluated the safety and efficacy of the vaccine and have authorized its use within its own territory. We are, like I said, we are also aware that the phase 3 trial is ongoing. As you have seen for other vaccines as of date, several national regulatory authorities did make that decision on the use of the vaccine in their own country based on the phase 1 and phase 2 trial, and moving into the emergency use listing of the vaccine. And we understand that at this point of time, based on the knowledge that we have, the similar process has been followed in Turkey. We look forward to receiving further information from Turkey on this process. Thank you.
Thank you very much for your question and for your response, Dr. Datta. We'll take a question here that we received beforehand, also on vaccines, from Vasilieva Maria from Izvestia in Russia. The question is, how resistant is this strain, so the Omicron strain, to vaccines, and is it necessary to tighten anti-COVID measures? We'll go first to the regional director and then to Dr. Datta.
Thank you. So we are following, as we mentioned before, vaccination plus approach. In that sense, it's a do-it-all approach. Not only vaccines or public health measures, we need to have the 5 stabilizers and show also the solidarity. There has been data that with the Omicron variant, the vaccine-induced immunity drops with the first and the second shot, but recovers by far after the third dose. Why we continue to advocate for the additional dose, but not as a standalone measure, as part of the 5 stabilizers.
Thank you. Dr. Datta, if you have anything to add?
Thank you, Banu, and thanks for asking that question. Just to follow, where Regional Director left, I think it's extremely important, as you have heard from the Regional Director in his inaugural, in the opening statement, that he reiterated that the currently available approved vaccines are effective in preventing severe diseases and death. I think that is extremely important for us to keep in mind. The Omicron variant is new. We are closely following up with the countries for their research on the vaccine effectiveness of the vaccine on the Omicron variant. As we have seen from the data that has come from the UK and also in Denmark, there has been some reduction in the vaccine effectiveness with the Omicron variant. But as you have heard Regional Director say, that with the booster, there is some restoration of that protection. I think it's extremely important that we remember that we should effectively use the tools that we have on our hand while we continue to do research and development in the, to provide better tools in the near future. So I think there has to be a balance in the use of the existing resources while looking for the newer evidence and also the newer tools to come through. Thank you.
Thank you very much. Let's go to Esmir Milovic, N1 Bosnia. Hi, Esmir.
Hi, Manu, can you hear me?
Loud and clear.
Okay, my question is on the situation in the Western Balkans. We know that some countries are basically recording the highest levels of infections at the moment. Also a question on testing. How successful are tests at the moment against the Omicron, and which would be recommended by WHO to be used to be most precise when it comes to the Omicron variant? Thank you.
Thanks, Esmir. Let's go straight to Dr. Smallwood on these. Thanks.
Thank you, Esmir. And as you said, some countries in the Balkans, namely Serbia, Montenegro, Bosnia-Herzegovina, are seeing very rapid increases in COVID-19 cases.
it's very likely that that's associated with the more recent spread of Omicron in those countries, as Omicron spreads across the whole European region. And so what we'll likely see is a picture emerge of further spread as Omicron overtakes Delta, which is also still circulating in the Balkans at the moment. In terms of what needs to be taken into account, first of all, in terms of tests, it's our current assessment that the tests available for COVID-19, both PCR and the rapid diagnostic tests that have been listed by WHO, work well in detecting Omicron as well as other SARS-CoV-2 variants. In fact, Omicron has a very specific signature in PCR testing that can be used to measure and used as a proxy to measure how it's spreading. And so that's quite important. Now, it is possible, because there are lots of rapid diagnostic tests on the market, and we don't have all of the quality information about all of them, that some, I can't speak for all of them, but most of those that are in use in most European countries at the moment can detect Omicron, and people should take a positive test, whether it's a rapid diagnostic test or whether it's a PCR test, as an indication that you might have COVID-19. If it's a rapid test, you might seek confirmation through PCR testing. The most important thing here is that for anyone testing positive is for you to isolate immediately, because it's around the time when people first develop symptoms and when people first test positive that people are at their most infectious. And so isolation at that stage is really critical, and notifying any people who you have come in contact with within the past 2 days previous to your onset of symptoms is also really important, so that they can take measures to protect themselves.
Thank you very much, Dr. Smallwood. Let's go straight to Johanne Monte from RTBF in Belgium.
Yes, good morning. Thank you for taking my question. Sorry, my camera doesn't work. I have a double question. Some countries are now seeing a change of strategy towards Omicron, like Israel, for instance, with new priorities in testing and tracing. So my question is, should we now really give priority to the most vulnerable and let Omicron circulate among the least vulnerable? That's the first part of my question. And the second is, do we still have to give priority to COVID-19 patients in hospitals, or is it time to make no difference between emergencies?
Thank you, Johanne. We'll go to the regional director first and then to Dr. Smallwood.
Thank you, Johanne. So the point is that every individual and the community, but individuals more and more now, because of the huge prevalence of infection in the community, need to do whatever it takes not to be infected, because there are too many unknown parameters still. One of them, the long COVID, which we really should not underestimate, is number one. Number two, remember the mantra, the more transmission, the more possibility for other variants. Especially now that we do have the tools. Then on the hospitals, it is true that the percentage or the fraction of hospitalized patients, not for COVID, but who are diagnosed with COVID because of the testing protocols, becomes higher and higher. So in some hospitals, we see a bit of a shift of the COVID patients from the ICU to the general wards. But again, the principle remains the same, that infection control is very, very important. We need to apply the tools and, of course, to really take care of the people with other conditions, which has been a challenge throughout. But the key issue that we see in the hospitals, and we anticipate in countries where the surge still has to arrive, is the health workforce, is really to keep the health workforce, which is overwhelmed or infected themselves. And that's what was my appeal in my statement, that governments and the public need to support the frontline workers, and we need to put mitigation measures in place to protect their mental health.
Thank you. Dr. Smallwood, anything to add there? Dr. Smallwood?
Sorry, I hope you can hear me. From the perspective of severity, and not to repeat the really on-point remarks by the regional director, but I wanted to make the point about severity. A lot is made about the characteristics of the virus of Omicron, particular in respect to its severity as compared to Delta, which, if you will remember, was characterized as significantly more severe than the wild type of SARS-CoV-2 that was circulating at the beginning of the pandemic. So we do have a slight decrease in the infection severity associated with Omicron as compared to Delta. But is that enough to justify and to explain what we're seeing in terms of a lot more milder infections? No. The reason we're seeing a lot more milder infections across Western Europe, in Israel, is because of the high vaccination uptake in our population. That immunity is basically meaning that we're able to tolerate, from public health perspective, a higher degree of infection in the population. And as much as we can tolerate that higher degree of infection in the population because of the vaccine coverage, we cannot necessarily tolerate the disruption that that's bringing to our critical services. The second point here is that we cannot generalize that scenario in all contexts. And in countries where vaccination rates are much lower than the very high rates that are present in Western Europe, including through booster vaccination, we cannot predict the same milder resurgence of cases. And we're yet to see how Omicron will pan out in a situation where there are more people susceptible and naive, immunologically naive to SARS-CoV-2. And that's where we need to hold our guns, be very cautious, and not jump to any conclusions about changing the strategy and letting COVID spread. That would be a grave mistake if it goes on to have very significant public health impacts in older age groups where we're yet to see the impact of the virus, and in communities where the immune systems are not as equipped as where we've first seen Omicron spread.
Thank you very much, Dr. Smallwood. Let's go straight to Moshe Appelblatt, Brussels Times. Moshe, please ask your question.
Yes, thank you very much, Banu. I would like to continue to ask some question about vaccination, which you already dealt with perhaps, but take first, let's say, the spread of Omicron. As you said, I mean, there is a surge now in almost all countries, but it might peak soon in 2-3 weeks. Is that also your prediction? And then the related question to that is, and that is linked to what Dr. Smallwood talked about the risk for severe cases and so on, and the high transmission rate. What I wonder is, if that high transmission rate, there's so many people being infected, I mean, is it possible to predict, I mean, how many will be severely ill and have to be hospitalized and also taken into intensive care? That might overwhelm the hospitals, right? And that brings me to my second question. I also would like to ask about the booster vaccinations, because I think you already mentioned that the primary vaccination, its effectiveness, it has been waning, perhaps already after 4 or 5 months. And now I think most countries in the European Union, at least, have started with the third shot already, will start already after 4 months. But do you think, are there any indications that also this third shot, the first booster, has, let's say, will wane, I mean, its effectiveness, so there will be a need for a fourth shot, which is already being given, for example, in Israel? And that, I think, also related to the previous questions about that we can't see any, let's say, change from a pandemic to epidemic during this year. So there might be need for recurrent vaccinations. What is your opinion about that? Thank you.
Thank you, Moshe. Well, I think we'll go straight to Dr. Smallwood, if I may, on some of these points. So some of them have been covered. We've discussed the peak, etc. But Dr. Smallwood, if you'd like to add, please.
Thank you, Banu. And Moshe, your questions are quite extensive and really good questions. And perhaps my colleague Siddhartha might be able to say something more about what we expect to see in terms of the vaccine strategy in the longer term. But I wanted to comment a little bit on the questions around what we're seeing specifically with Omicron in terms of severity, and this is on the basis of a subset of case level data that gets reported to WHO Europe on a weekly basis from member states. And bearing in mind, this is still initial data, but this is based on approximately 30,000 cases that are reported to WHO. And yes, we are seeing a lot more milder cases, as I said before, because this is predominantly moving through a population that is already protected either through vaccination or through prior infection at the moment in Western Europe. But even within those cases, we are seeing a majority showing symptomatic disease, a range of symptoms from mild to moderate symptoms. And that's at approximately 89% of the cases that have been reported to us. So a very significant majority of cases remain symptomatic. In terms of those cases that go on to be hospitalized, we are still seeing a number that is approaching 1% of cases. That means 1 in every 100 cases will still go on to be hospitalized. And that's not so different to what we were seeing for other variants. However, as the regional director highlighted, we're seeing early data and early reports from hospitals that even once hospitalized, the progression to requiring ventilation is less with Omicron. And that's that's an important point. But we are still seeing hospitalizations. We're still seeing a lot of people sick. And so it's very important that even within this highly protected, vaccinated population, that we understand that the disease COVID-19 can still be serious. And so I think this is where we need to be very careful about jumping to conclusions too quickly and taking the next weeks to really, as we've done in the past, say when we're making decisions on strategy that may lead to an increase in cases, that we proceed cautiously and on a stepwise manner on the basis of continuous risk assessment. And that would be the principle moving forward, not to lift everything and jump to conclusions. We can be very optimistic that this might bring a new phase of the pandemic, but we're not quite there yet, and we're not confident in saying to move forward in that manner.
Dr. would you like to add?
Thank you. Yes, thank you, Mose, for that part on the vaccination as you connected. But I think let me reiterate a couple of things here. The first thing is that WHO still recommends that every country need to ensure a very high uptake with the primary cities or primary doses. As you see, as of date, around 60% of our region's population have completed their 2-dose schedule, which means 40% of our region's population haven't received a single dose. I think that's quite important parameter. You have heard Regional Director highlighted in his inaugural words that we still need to have very high primary cities coverage, plus moving on to the booster. The booster vaccination program was the technical advisory group of experts in our region have looked into the need for the booster. And I think it was highlighted because of the high transmission in the WHO European region, plus the early evidence on waning of the immunity from the vaccines that we are seeing. The vulnerable population group, again, was requested to be prioritized by each and every country. The essence of this entire booster or the primary vaccination program is to protect the vulnerable. We know where the virus is. And I think we have learned it from the last 24 months. So this should be and remain the main essence of any vaccination policies or strategy moving forward. There are several unknowns. We are aware of it. And I think the vaccination program and the vaccination strategies as WHO has been working with our member states were defined on making provision for the newer entity by learning from what we have seen until date. So I think it's not an issue of only knowing which new vaccine would come, but I think it's also important that we effectively make use of the vaccine doses which are available, so that the vulnerable population groups, the population which are still left unattended in each and every country, are being reached as soon as possible, both with the primary dose series and also with the booster in the long run. Thank you.
Thank you very much, Dr. Datta. Let's go straight to Jeremy Launch from Radio France Internationale. Jeremy.
Hi, can you hear me?
Yes.
All right, thank you so much. Just a quick one. There's a word that the governments and obviously the population in Europe don't like to hear, is the word lockdown. The Netherlands are experiencing one right now. It could be reinforced, as I understand, by the end of the week. Given this tidal wave that we're in, and given what Dr. Smallwood said about not making any difference between vaccinated and non-vaccinated people, I was wondering, should lockdowns be completely put aside in Europe, or is it something that WHO is ready to consider? I mean, are we done with the lockdowns or not?
Let's go straight to Regional Director on that one.
Yes, thank you, Jeremy. So I think in the beginning of 2020, the lockdown was basically a shutdown. The whole world economy came to a standstill. Since then, both as a community and governments, we learned to apply tools to have a fine balance between life and livelihood. So in that sense, if the pandemic stabilizers are being applied, there wouldn't be a need for a lockdown. But one of the challenges have been that too often countries thought that the pandemic came to an end, when in reality it was just another tidal wave passing. So lockdowns, just like mandatory vaccination, should be tools of the very last resort, temporary. In some extraordinary situations, it may give a little relief, particularly to prepare the health systems. But of course, everything should be done to try to avoid lockdowns. If they are, for example, locally applied, then there's a responsibility to take care of the mental health of the people, to put measures in place to detect and prevent domestic violence, including intimate sexual violence, and to provide microeconomic support to the most affected.
Thank you very much, Regional Director. I think we have time for another question. It's Stefano Valentino, who doesn't have a mic, so has sent his question via the chat function. The question is, while Dr. Hans Kluge recommends European countries administer boosters to their entire population, Dr. Tedros from our international office in Geneva officially stated that generalized boosters are not a way out from this pandemic. So in short, he would like to know if we could clarify whether there are diverging views around the third dose between the Europe office and the international office.
Thank you very much. We do not see any contradiction over there. I think the spirit is that until and unless there is vaccine equity globally, we are not going to get out of the pandemic. And the vaccine inequity is still glaring. But it is not one or the other. It's a do-it-all approach. And I think our continent is a front runner in sharing vaccines, although much more needs to be done. Also in putting up technology in South Africa through a new mRNA hub for the vaccines. But since the beginning, indeed, the WHO Regional Office for Europe for the pan-European region has been advocating, based on the science, for booster doses, which, as you see, for the Omicron in particularly is very important. But again, the point here, not boosters alone. There is no country which is going to boost itself out of the pandemic. It needs to be ingrained in all the 5+1 pandemic stabilizers.
Thank you very much, Regional Director. on this note, let me thank everyone and close the press briefing for today. Many thanks, obviously, to Regional Director, but also Dr. Smallwood and Dr. Dutta for their time and for their expertise. And thank you to you, members of the press, for joining the press briefing today. If you need additional follow-up, and I know there's a few of you that have some follow-up questions, and I'm sorry we weren't able to get to them, please contact us by email using the details that were provided in the invitation. We will get back to you with answers. As always, stay healthy, take care, and once again, Happy New Year. Goodbye.